We are live. Hello, good morning, everyone. Today's session is going to be really helpful, and it is led by Dr. Ramya from Apollo Cradle and Children's Hospital. She's going to talk about gestational diabetes mellitus. So, stick around until the end and ask questions if you have any. Let me not keep you any of you all any longer. And, Doctor, you have the stage.
Hello. Namaste. So today I'll be talking about gestational diabetes mellitus, commonly called as GDM. So GDM is a type of diabetes that a woman develops during pregnancy. She is not detected diabetic before pregnancy. So what generally causes GDM is generally the blood glucose is absorbed into the blood cells through the insulin receptors. But in pregnancy, these insulin receptors are blocked by the placental hormones, and therefore the absorption is reduced and increases the blood glucose levels. Coming to the signs and symptoms of GDM, usually there is no particular sign or a symptom of GDM that a woman shows during pregnancy, and that is why screening of GDM is very important. So it is usually done at the booking visit or in the first trimester, and if the result is negative, it should be repeated at 24 to 28 weeks. So the popularly done screening test is the oral glucose challenge test, that is the OGCT. Here, the pregnant woman is given a glucose load, 75 grams of glucose load. She has to mix it with around 250 ml of water and consume it within 10 minutes. And 2 hours later, her venous blood is drawn for blood sugar values. If the value is more than 140, she is diagnosed GDM. And this test is regardless of whether she is in the fasting state or the non-fasting state. Okay. And coming to the risk factors and prevention of GDM, the risk factors are age when the age is more than 35 years, and overweight and obesity when the woman's BMI is more than 30, and with a positive family history of either gestational diabetes mellitus or diabetes mellitus, previous history of GDM in previous pregnancy, and multiple pregnancies, or if a woman had a slightly elevated blood sugars in her previous pregnancies. And prevention is by maintaining an ideal BMI before pregnancy, and if there is a positive family history, and regular checkup of blood sugars should be there, and a proper preconceptional advice to be taken. If a woman's HbA1c is less than 6.5, then the pregnancy, she can plan for her pregnancy. Or if the HbA1c is more than 10, then she has to delay her pregnancy and follow some kind of contraception. And if in case she has to plan pregnancy with a poor glycemic control, then her oral hypoglycemic drugs should be shifted to insulin. Okay. And exercising, because exercise reduces the need and also the amount of insulin that is required. And also folic acid supplementation should be started preconceptionally. Okay, next, coming to the complications of GDM, high blood sugar levels affects both the pregnant woman and the fetus. So in the women might develop high blood sugar, high blood pressure, and she might end up in preterm deliveries, and she might develop skin infections and vaginal infections. And because of the unusually large baby that she develops due to GDM, she might end up in instrumental deliveries and cesarean section. And also, because of the macrosomic baby, she might have a little distress in her later part of pregnancies, I mean, breathing difficulties. And in the baby, immediately after the delivery, the baby might develop hypoglycemia, natremia, hypocalcemia, and also jaundice, and which the baby should be treated accordingly. Future development of diabetes both in the mother and the fetus is really high. Okay, and coming to the management part, the first important thing is the lifestyle modifications, which includes diet and exercise. So diet, the calorie intake of a woman will be calculated based on the BMI. So consultation with a dietitian to form a proper food chart for the women is important. And exercise and yoga is also very important, because on while exercising, the skeletal muscle absorbs more of glucose, so the blood sugar levels will be less. So when these nutritional advisors and exercises fail to bring down her glucose levels, then we go into drug treatment. So drug treatment, what we initially start with is metformin. So usually most of the women respond to metformin. When there is failure in the reduction of blood sugar levels, then we switch over to insulin, which is very safe in pregnancy. So, to in case if the blood sugar levels, the fasting blood sugar levels of a woman is more than 120, then we have to start with insulin immediately, along with the diet and exercise. So, to conclude, in order to maintain a woman without any complications, that is a without the future development of diabetes or obesity or cardiovascular risk factors, then healthy lifestyle should be practiced by all pregnant women, not only in pregnancy but also after her delivery. Thank you.